How are you going to know that fluoride is affecting you if you've been using fluoride your whole life? Dentists are the least informed when it comes to the calcification of the pineal gland and fluoride. So me as a dentist, I'm making this video to make it more clear for you, to present you the evidence so you can take a rational decision whether to use it or not. So why is fluoride recommended in the first place? Fluoride is attributed to make the enamel more acid resistant. So the ions of fluoride are highly electronegative. This means that it attracts acid ions. So in a surface that is decayed, it helps with the remineralization of this surface. To give you a rough example, if I'm making a composite filling, and if this patient is brushing his teeth before doing this procedure, this could compromise the bonding protocol. Why? Because fluoride makes the enamel more acid resistant, and during this procedure I require acid. So yes, fluoride makes the enamel acid resistant, but even the studies that support fluoride talk about how fluoride is not necessary for tooth development, but it talks about the diet and the hygiene. So it all comes down to that. So to understand the toxicity of fluoride, I think I need to mention you different things that happen with fluoride. So fluoride is a recent thing. I mean, how do ancient civilizations did thousands of years ago? The Mayans, they had great dentistry work. They even had gemstones on their teeth. It all comes down to the diet and the hygiene. So fluoride is not necessary. It's a recent thing. 1945, Grand Rapids, Michigan. They fluoridate the water with the justification of the study of 30,000 kids. By 1950, they fluoridate the whole water in the country. With no follow-up, just saying, well, this prevents decay. Why you didn't make a campaign to promote hygiene and diet? Because it makes more sense to fluoridate everything, and you will understand why. So the toxicity of fluoride, I mean, the most remarkable case happened at the Oregon State Hospital. They were mixing 10 gallons of eggs with 17 pounds of sodium fluoride, thinking that it was powdered milk. So more than 400 people were intoxicated, 260 something were heavily poisoned, and 47 people died. So yes, fluoride is a serious thing. There's cases registered, people that committed suicide using fluoride, and it was used as a poison and as a pesticide. So like I said, it's a serious thing. Using people with yellowish, white, brown, kind of like dark spots on their teeth, that's a high concentration of fluoride. And this condition is called fluorosis. So fluorosis is a hypomineralization of the enamel, low mineral content. And it looks like this. And you might be asking, if I have this, will I still get cavities if I have a high concentration of fluoride on my teeth? Yes, just look at these images. I have done extractions on patients with fluorosis, and those teeth are fragile. They come out in pieces. So fluorosis is a condition that can be treated with aesthetic work, composite veneers, ceramic veneers, crowns, whitening, and this could help to improve the aesthetics. If you're a pregnant mother or if you're a kid between 20 to 30 months old, and you consume fluoride, keep in mind that 75% of the consumption of fluoride comes from tap water. So the rest is toothpaste and mouthwash. But if you're a pregnant woman or if you're a kid between 20 to 30 months old and if your consumption of fluoride is high, you could develop skeletal fluorosis, which looks like this. It deforms the bones, it makes the bones weaker, and it affects the whole body. So fluoride is not essential. And to talk about the calcification of the pineal gland, I think we need to first mention and give this introduction to the person that gave the most beautiful introduction to the pineal gland. And we need to go back in time to the 16th century. French guy, mathematician, philosopher, scientist, physicist, the type of guy that is ahead of his time, a genius. This guy didn't care about fame, he didn't care about recognition, he cared about simple things. I'm talking about René Descartes. This guy was a rationalist, and he considered the pineal gland the seat of your soul. So this was a genius. And ironically, René Descartes had 3 dreams, and later on, after those dreams, he developed analytic geometry, and he developed his life to a purpose. He dedicated his life to a purpose, to a mission, and this mission was the search of true wisdom and the search of truth, which, you know, it's kind of like how a guy that is, you know, using math as his safe zone was, you know, having some dreams and dedicating his life to those dreams. Well, he considered the gland the seat of the soul. And I'm talking about the guy that was studying all of his life. So if you have René Descartes on one side and you have a dentist on the other side, and you have this dentist telling you, hey man, brush your teeth with fluoride, it's good for your teeth. And you have René Descartes on the other side telling you, hey, brother, the pineal gland is the seat of your soul. Take care of it. Who would you listen to? A dentist that it was taught in college that fluoride is a good thing and that is rejecting the information of the calcification of the pineal gland, or René Descartes? I mean, just by pure rationalism and logic, I will listen to René Descartes. For me, it makes more sense. And René Descartes wasn't talking about fluoride, okay? But just by logic, I think I will listen to René Descartes. René Descartes was a rationalist that justified his existence by doubting. And he had a famous quote, I think, therefore I am. So if you doubt, you know that you exist. And reality could be very subjective for each person. But why is the pineal gland so important? I mean, in animals, because René Descartes was studying the pineal gland, not just in humans, but in animals. In animals, the pineal gland is related to migration, hibernation, reproduction, and detecting the season of the year. So in humans, the pineal gland produces melatonin. Melatonin is the hormone that you secrete when you go to complete darkness. So this gland is stimulated with natural sunlight. So you need natural sunlight that goes directly through your eyes, and it goes to the center of your brain where your pineal gland is located. Actually, that's one of the reasons that the position of the pineal gland is right at the center of your brain, and that's one of the reasons that they call it the third eye. So good production of melatonin will produce, a healthy pineal gland will produce good levels of melatonin. The highest concentration of serotonin is at the pineal gland. Melatonin is a derivative of serotonin. So having a healthy pineal gland, it's essential for the wake-sleep cycle, for the circadian rhythm. So the circadian rhythm is stimulated by natural sunlight. If you're the type of person that goes to bed with the phone all the time, or watching your TV, having a lot of LED light at your room, you're disrupting your circadian rhythm because of the blue wavelength light that enters through your eyes. You're breaking a natural cycle by getting artificial light. So stimulation of this gland, of the production of melatonin, will be directly affected by the source of light you have. Now, if you have a calcified pineal gland, how are you going to produce good levels of melatonin? So they did a study on a goosander, a bird, and this bird was consuming fluoride for X amount of time, and later on it was found that the pineal gland was calcified because fluoride has a lot of affinity for calcium. If you're a little kid that is less than 6 years old and you're ingesting the fluoridated toothpaste, you have to call the poison control center. Typically, the treatment is to give calcium because fluoride has a lot of affinity for calcium. So calcium deposits are accumulated at your pineal gland if you're consuming fluoride on a daily basis. So the calcification of this gland is not just related to fluoride, but it's also related to aging. Patients that die from renal disease had the highest concentration of pineal gland calcification, and also hypertension. So it comes down to the diet. So it's kind of like all related. Schizophrenia, it's related also to pineal gland calcification. So if you affect this gland, you cause neurological problems. So having healthy levels of melatonin and having a healthy pineal gland will give you anti-cancer effect, antioxidant, immunity, metabolic balance. It will work as a neural protector. So it's important to have a healthy pineal gland. They did another study on rats where these rats were consuming a diet high in fluoride, and then they switched the diet to a fluoride-free diet for 8 weeks. And they killed the rats, and they found that the gland was decalcified. So yes, you can improve decalcification of the gland just by having a good diet. So, man, consider this information important to improve your overall health. Actually, people that have night shift work have higher risk of having cancer. And this was said by the International Agency of the Research of Cancer in 2019. I mean, there was still a lot of study that it needs to be done in regards to that matter. But if you're breaking your sleeping cycle regularly, this will compromise the circadian rhythm and how your body repairs. So it all comes down to the diet. Everything. So everything is related. So if you want to know if the pineal gland is calcified, you can only know this with a radiographical study, a CT scan or a scan, a tomography, that it will tell if it's calcified. But it's hard to tell just by having a conversation with someone if it's calcified. There is a famous meme that says that when you try to have a deep conversation with someone and they just give you the fluoride stare. So I'm not trying to make fun of anyone that is taking fluoride, but I want to inform you so you can make a rational decision to use fluoride or not. It all comes down to the diet, pretty much. The best medicine in the world is food, and the best therapy, it could be considered exercise. And saying exercise, I'm just saying go for a walk. So if you take care of the food you eat, and if you move a little bit, the perception of reality will be improved. So if you're the type of person that just gets ordered and you follow those orders without questioning, consider why am I following these orders? So the point of the video is not that. It's just to tell you the effects of fluoride, the calcification of the gland, the relation between neurological problems and the calcification of the pineal gland, and is not only fluoride but just the food that you eat. And yes, you can decalcify the gland by having a good diet and by moving your body. So hope you find this interesting, and I'll be making more videos about it.